once again, and thank you, Dr. Sushmita, for including the program. And I apologize, I have to go to another session immediately after this, so kind of insisted on me being taken first. Which glaucoma is more blinding? All glaucomas are potentially blinding, and if you look at the WHO statistics, 8% of blindness is because of glaucoma, and this is the problem is only actually going up with time. Glaucoma blindness is but unfortunately, all glaucoma is not equally blinding. Some are more blinding, and others are less blinding. So in this study, in this talk, we'll look at some of the cases which glaucomas which are more blinding. But having said that, before we go to that, phenotype is important, of course, that kind of glaucoma we are dealing with. But occurrence of blindness is also influenced by other factors, external factors, and which could be the delay in diagnosis, which is very common, and also the compliance, which is again problem with the compliance, which again is a very problem. And there could be many other systemic conditions or ocular conditions, as well as social, financial, those constraints, which could also contribute to, suboptimal results. So we have to keep those things also in mind. And this is just to remind that the world population is increasing, and, by 2040, will be almost double the numbers that we were in 2010. So we would expect more of these cases, since glaucoma is an age-related problem. If you look at the blindness, bilateral blindness figures, there's quite a bit of blindness, and if you from 210 to 220, it's kind of almost doubled, and you're going to have more cases in coming years, as I mentioned, because the population is increasing. And you can see the share of angle closure is almost 50-50, but if you look at the Asian perspective, most of these primary angle closure glaucoma, which are responsible for almost half of the global burden of blindness, they would be in the Asian region, and of course we are where all this is happening. So angle closure, if you look at the angle closure disease and the blindness figures, the blindness rate with angle closure, this is for Chinese population, almost up to 38% of angle closure. The blindness due to angle closure is quite high. And if you look at the recent literature, it's kind of suggests that the PACG almost 3 times more blinding in the POAG. So this is very important lesson, basically, to keep in mind that angle closure is very common in this part of the world, and it is also more blinding than the other glaucomas, and this is also often missed disease. So we need to be careful about not missing angle closure disease. I think that will be that will go a big way in preventing unnecessary blindness in the community. The second I want to draw your attention is to periodic glaucoma, because congenital glaucoma is kind of a little rare in the sense that you see in one into 20,000 to 1 in 30,000 live births, but India overall has a bigger population. Also, I think it has a little bigger share of periodic glaucoma patients, and also you have juvenile glaucoma, like late onset glaucoma, and also glaucoma associated with other congenital malformations, so that also needs to be recognized. Then, of course, you have the secondary glaucomas, which again are quite common. And in fact, in my practice in a tertiary eye care center, if we look at all the glaucoma patients, half of our glaucoma patients have a primary variety and half are the secondary variety. So there's a good amount of these cases, and with a lot of newer techniques, coming in, we are getting, more post-surgery glaucoma patients, post-vitrectomy, silicone oil, buckles, and of course we know the neovascular disease, uveitis, post-penetrating keratoplasty. So all these patients, they tend to be high-pressure glaucomas, and also because in these patients the optic nerve damage happens because the essentially high pressure, and also how fast the pressure goes up and the magnitude of the IOP. Now, these secondary glaucomas, they tend to have very high magnitude of IOP, which could damage the optic nerve very early. So we need to recognize these conditions at the earliest and handle them with the earliest. And if you look at neovascular disease, the blindness in both or one eye has been reported up to like 14 to 31%. So there's a very high incidence of blindness in neovascular disease. So make sure that you identify the neovascular glaucoma in time and take the appropriate measures. And because the neovascular glaucoma is also associated with poor vision. Now, this could be because of glaucoma and could also be because of the posterior segment pathology, because many times neovascular glaucoma happens secondary to a posterior segment pathology. So visual outcome is actually a little low in these patients. Then post-penetrating glass keratoplasty, here again the challenge is to, number one is to keep the graft clear, and also to keep the optic nerve healthy. And generally, the glaucoma actually affects both. So if you have a glaucoma, there's a 50% chance of failure of the graft, and also there's a the overall visual outcome is poor in these patients, and despite all the efforts, only 20% eyes, they would have a visual acuity of 20 or 60 or better if the PK, post-PK eyes, if they develop glaucoma. So again, we have to be more aggressive here in detecting and also monitoring these patients and treating glaucoma, lowering intraocular pressure whenever that happens. Now, inflammatory glaucoma, this is a very varied group, and there's a lot of variations here. There could be a mild self-limiting, transitory eyes in IOP, which just needs, temporary lowering IOP, and basically is a self-limiting disease like Boston-Schlossman syndrome, but the pressure can really go up. Or you have, like Fuchs heterochromic uveitis, which can be, easily managed. But there could be very, severe conditions. Sometimes there's a disorganization of the anterior segment, and which could actually produce a very intractable kind of a glaucoma. To conclude, the secondary glaucoma phenotypes are more blinding in generally speaking, and certain glaucoma types more blinding in generally speaking, and the blindness also depends on other factors other than the phenotypes. But PACG is a common in our population, and half of our patients, or maybe more than half of the primary varieties, are angle closure disease, and this is something which should never be missed, and this is the condition which is often missed. So I think if you can just remember angle closure disease not to be missed, I think that is important, will be an important lesson. Thank you.